This is the Ghana Registered Nurses and Midwives Association. The others within their fold say, look, we have not agreed on a strike. We agreed to go and engage the minister, finish with the minister, and then when we don't see any headway, we will hit the streets. They left that meeting, the Ghana Registered Nurses and Midwives Association. They say, we are going on strike. Of course, they have a right to go on strike, if they so wish to go on strike. Now, they say between the 2nd to 3rd of June, that's yesterday and today, they will wear red armbands, headbands at work. 4th to 8th of June 2025, withdrawal of all OPD services, including public health services, ANC services, and all specialist clinics. Then the 9th of June, there will be a total withdrawal of all the services. Now, they are doing this strike because of a collective agreement that they had. It's there, that document is there, circled green. Now, that collective agreement that they had was supposed to have been implemented by the 1st of July 2024. Come to me. By the 1st of July 2024. That agreement that was had, which was signed by Engineer Ben Arthur, who was then at Fair Wages and Salaries Commission, who later went to contest, is there a ticket of the MPP? Yes? That's one. Now, the chief director of the ministry at the time also signed. Then Auntie Perpetua at Ghana Registered Nurses and Midwives Association also signed. Then the secretary of that union also signed. That agreement was supposed to have been achieved or supposed to have been kick-started on the 1st of July 2024. The common sense question that you ask is, why did they all keep quiet when it was 1st July 2024? Why did they not say anything about it in 2024? July came, July, August, September, October, November, December. Right? Those months came. Then we went for the elections. And then after the elections, January, February, March, April, May, then they are complaining. Legitimate that it's taking too long. But the first common sense question to ask is, why were those questions not asked then? Was there a political underlay? Because now if you speak to some of the nurses, they are saying that Madame Perpetua is married to a certain politically exposed person. So I don't know if that is the case. Say she's married to a certain politically exposed person. That could be the reason that this is being pushed at this time. I don't know. If they have agreed, let the agreement go on. But one of the things that I found in the agreement, reading it 2 days ago, was that nurses and midwives were going to have their licenses renewed by the state. Nurses and midwives. The renewal of their licenses, which was their duty, or which is their duty, will now be renewed at the expense of the state. The state has to pay for it. So I paused and asked myself, let's assume that we agreed to do it for the nurses and midwives, that when your license expires, we will renew it for you as a state and pay. Then the architects and engineers at AESL will also come. Say, oh, we also work for the state. When our licenses, or we have to renew it, you have to pay. Then the lawyers at the courts who work as state attorneys and all of that will also come and say, if we have to renew it, you have to pay. Then other professionals within the field, HR professionals will come, PR professionals come, my IPR subscription, you have to pay. Everybody will now come. Can we as a country fund it? No, I'm asking you, can we as a country, if everybody comes to say, I'm a professional, I'm working for the state, so pay. How many nurses and midwives do we have in this country? And at this point, when we all know that our kitty is empty, we know over 700 billion was what we owed. We know what our debt stock is. Even though this government claims that they are paying some of the debt, we know what our situation is. We know that we don't have the money. And because we knew that we didn't have the money, that was why when on the 1st of July 2024, when the matter was right for us to kickstart this whole initiative, the collective agreement, we kept quiet. Because it was an election year. Because if we spoke and we made noise and we gave a roadmap, it was going to affect the electoral fortune of a certain regime. So we kept quiet. These things I'm saying to you, aside what I said about the licenses, when you speak to the nurses at the various facilities, they know. I take my time and go on the ground. If I weren't on the ground, I wouldn't know Tete Tiinku, for example, at Teshi. I wouldn't know that there's somebody there who does song, Akutu and Akwadu song and Odaklo songs at Teshi called Tete Tiinku. The people at Teshi, they know him. The people at La, they know him. Nungwa, they know him. You go on the ground, the very lowest people who the politicians do not regard necessarily, they are the ones you interact with, and they will give you the raw street sense. So yes, it's okay for you to have a roadmap, but the question is, let your conscience also guide you. 1st of July 2024. That was when it was dated to take effect. Engineer Bernata can bear me witness. Madame Perpetua can bear me witness of what I'm saying. The document is there. Maybe tomorrow I have to show the document. The full collective agreement that was reached, I have to show one of the clauses in there. It says their licenses for nurses and midwives have to be paid for, borne by the state. And I'm asking, if we pay for them, won't teachers also come? Won't doctors come? Won't lawyers come? Won't architects and engineers come? Won't HR people come? Won't PR people come? Won't other professionals also come and say, we work for the state, so pay? And I'm asking, where we are now as a country, do we have the funds to pay? I'm just asking a simple question. Don't get angry, and don't get it wrong from me. I'm just asking a very simple question.